Welcome. I am Terry Tropin, and today I'll be discussing 2023 updates for CPT's evaluation and management codes. I'll do this through presenting a case and going step by step to the selection of the code. First, let me tell you a little bit about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHEMA approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, one on ICD-10-CM coding, and one on ICD-10-PCS coding. These are available on Amazon. If you'd like to purchase a copy of the slides for this video, give me a thanks of $5 or more and comment with your email. I will send you, with your email address, I'll send you a PDF of the slides. Click the thanks button under the video. Okay, so this is an overview of what I'm going to talk about today. I'll present an office or other outpatient case and then go step by step through the process of coding this case. This includes determining the medical decision-making level, determining the correct code if it's selected using medical decision-making or MDM only, and then determining the code if it's selected using time only. Okay, this case is an office visit setting. These are reported using codes 99202, 99205, or 99212, 99215. So the new patient codes 99202, 99205, established patient codes 99212, 99215. The code selection for these sets of codes are based on either medical decision-making or time spent with the patient. The time for these codes is expressed as a range. Some other codes will say meets or exceeds such and such amount of time, but in this time, it's a range of time. For example, 20 to 29 minutes. Okay, so here's the case we'll be discussing. A 7-year-old female established patient is brought to the physician's office by her mother because she has a fever and complains that her ear hurts. She has no significant medical history. The child is not happy to be seen in the physician's office and has been crying. She's unable or unwilling to answer questions and resistant to the examination by the doctor. The mother reports fever for past 3 days, altalgia, headache, irritability, cough, rhinitis, and she's pulling at her ears. Her temperature is 100 Fahrenheit, no prior history of otitis, but the mother also notes that the brother was sick with a cold earlier this week. Okay, what do we need to know in order to determine the code? What you need to do is read the case and then pull out the information, underline the information that you need in order to select the code. A lot of this will not be relevant to code selection. Okay, first we see she's an established patient. Then we see that the mother reports the information. So we have a historian here. No prior history of otitis, so this is not recurrent otitis. The physician examined the patient. So what do we need to select from this code? So let's read it first. An appropriate history and medical examination were performed. The only abnormalities found are slight redness of the throat, a nose full of thick green mucus, and infected tympanic membranes. An otoscopic examination also confirmed bulging tympanic membranes, but no effusion. A sample was taken from the throat for a test to determine infectious agent. So what do we need to know about this? Okay, an appropriate history and physical examination were performed. Remember that these codes, as of last year, don't have counting elements of history, elements of physical exam, but it just says appropriate. So what the doctor did is appropriate. We also see an otoscopic exam to confirm bulging tympanic membranes. This gives us more information. And a test was done, a sample was ordered from the contents of the throat. So after talking to the mother and examining the child, the physician determined a diagnosis. The physician, excuse me, diagnosed the patient with otitis media with related upper respiratory infection. Amoxicillin was prescribed. The physician cautioned the mother that the condition must be treated and monitored because of possible hearing loss, worst case scenario. No surgery was predicted at this time. However, if the condition persists, a tympanoscopy may be necessary. It's tubes in the ears. Now, the physician talked with the mother about the pluses and minuses of the tympanoscopy, and a decision will be made later. Total time for the visit, 45 minutes. So let's look at medical decision-making. So remember that for this specific case, remember the components of medical decision-making include the number and complexity of problems addressed at the encounter, what's wrong with the patient, and how serious is it, how complex it is, the amount and complexity of data to be reviewed, what does the physician need to, what information does this physician need to collect in order to select a diagnosis or a management plan. And then the risk of complications and morbidity or mortality of patient management. How will the treatment, how risky is the treatment? How complicated is the treatment? So again, the levels of MDM are straightforward, low, moderate, and high. So problem addressed medical decision making, we have straightforward, low, moderate, and high. And these are strictly defined in that table in your CPT book. So straightforward, one self-limited problem. Low, two or more self-limited minor problems, or one stable chronic condition, or one acute uncomplicated illness or injury. One stable acute illness, one acute uncomplicated illness or injury requiring hospital inpatient or observation care. Moderate is one or more chronic illness with exacerbation, progression, or side effects of treatment. Two or more stable chronic illnesses, one undiagnosed new problem with uncertain prognosis, one acute illness with systemic symptoms. That sounds like a possibility. One acute complicated injury. High level is one or more chronic illnesses with severe exacerbation, one acute or chronic illness or injury that poses a threat to life or bodily function. So where does this case fall? Remember, it says otitis media with related respiratory infection. Often the ear infection is a result of a respiratory infection. The infection moves into the ear. So you see that I put this as moderate. So if you look at one acute illness with systemic symptoms, the second to last bullet, that seems to fit. Okay, so let's look at the next element. Amount and our complexity of data to be reviewed and analyzed. This is also straightforward, low, moderate, or high. So straightforward, minimal, or no data needs to be collected or reviewed. Low is there's category 1 or category 2. Remember, this section goes into category 1, 2, or 3 as possible areas. So for low, you have category 1, review of external notes from each unique source, review of results of each unique test, and ordering each unique test. Category 2 is independent historian. For moderate, you need at least one of the 3 categories. Category 1 is any combination of review of external notes, review of results of each unique test, and ordering each unique test, and independent historian. So you see independent historian under low is a separate category, but it's lumped in with category 1 for moderate. Category 2, independent interpretation of tests. Category 3, discussion of management or test results. For a high level of data reviewed, you must have at least 2 of the 3 categories. Category 1, which we've already described. Category 2, independent interpretation of a test. And it's added category 3, discussion or management of test interpretation. So this category 3 is only in moderate or high. So where does this patient fall? Well, I say it's in moderate. You need at least one of the 3 categories. So how do we get there? Ordering lab tests to determine the infectious agent, reviewed the results of the otoscopy. We saw that the tympanic membrane is bulging and that there's no effusion, and discussion with the mother, the independent historian. So again, that makes this moderate. So let's look at the final component, which is risk of complications and or morbidity or mortality of patient management. This is the risk of the treatment, not the condition. So here are the possible levels: straightforward, low, moderate, and high. Straightforward, minimal risk; low, low risk; moderate, and high just give you examples. So we have moderate prescription of drug management, decision regarding minor surgery, decision regarding elective major surgery, and diagnosis or treatment of social determinants of health. High is examples, again, drug therapy requiring intensive monitoring for toxicity, and decision regarding surgery. This includes elective major surgery with identified major or procedure risk factors, emergency major surgery. So elective, we're going to have a major surgery in 2 weeks. Emergencies, we got to do surgery now, of course. Condition regarding hospital or escalation of hospital level care. So the decision to hospitalize an outpatient or move a patient from inpatient to critical care. Do not resuscitate because of poor prognosis or parenteral controlled substances. So where does this case fit? Again, I would say this is moderate because there was a decision concerning minor surgery at this time. So it counts as decision for minor surgery because it was discussed. The possibility of tympanostomy was discussed but not ordered at this time. If you look at the definition of risk included in your CPT book, it says that. There's social determinants of health, but we've got minor surgery. Okay, so where are we? We have problems addressed, moderate; data reviewed, moderate; risk, moderate. So everybody's at a moderate level. So based on the moderate level, what code is selected? So we know it's an established patient. So we'll narrow it down to 99212, 99215. We know that those are the codes we're going to select from. If we're selecting using medical decision-making, moderate, it's 99214. But on the other hand, if you do it according to time, which is 45 minutes, it's 99215. Remember that these codes can be selected using either medical decision-making or time. Code 99215 is 40 to 54 minutes, and the time was 45. So obviously, we will select the higher level code, 99215, for this case. So that completes the video. If you have questions or comments, please feel free to contact me. For a larger discussion of E&M coding for 2023, see my other videos, 2023 Evaluation and Management Updates. If you'd like to purchase a copy of these slides, please give me a thanks of $5 or more and comment with your email. I will send you a PDF of the slides. If you enjoyed this video, please give it a like and subscribe by clicking on the picture in the lower right-hand corner. And again, here are the books I have written on coding. These are available on Amazon. The updated 2023 books for PCS and CB and CM are available on Amazon. The link is listed in the code description as well as here. Thank you so much for listening. Thank you. Jesus, that was bad.